Hello and welcome to lecture 6. Found this, a while ago and thought I would share because isn't this very truthful? So, one of the things I want to talk about is how do you feel about giving and receiving feedback? As we will be going into having our group therapy sessions where all of you will lead a group, participate in multiple groups, and also observe multiple groups. So, questions to consider when providing feedback. This is not only for the group experience, but also for just other situations. You want to think about how you convey warmth, kindness, respect, and have the other person's well-being in mind. You want to build up, strengthen, and encourage. Consider the context. Remember that leading a group for your peers and in front of your peers is a challenge. Consider and acknowledge the effort and planning that took place to create your group experience or your peers' group experience. Observations remain non-judgmental, but specific in what you noticed, what worked well, what needs improvement, and be specific, useful, constructive, polite, and concise. For example, Jim, I really loved how you had that activity exploring your feelings, and it helped us to develop insight. What I did notice is that you seem to rush through the process a bit, and I was left wanting to sit in the feelings and have just a bit more time to reflect. Provide a suggestion on how this may be improved. So, considerations for receiving feedback. Remember that you don't know what you don't know. You want to remain open and teachable. Just because you're receiving feedback does not make you any less of a person, but it is for the purpose of honing and strengthening your skills. Hearing feedback may create anxiety. And again, remember the purpose is to help you sharpen your skills. Acknowledge the anxiety. It's okay. Take deep breaths and remain non-judgmental towards a person as well as towards yourself. You have a unique perspective. Your peers have a different and also unique perspective. Manage your defensiveness. Notice it, name it, and maybe later process it, perhaps in supervision or with a trusted colleague. On the other hand, sometimes compliments can feel really uncomfortable. You want to express gratitude and receive it. Thank you for your comments. And avoid using self-deprecating remarks. Thanks, but I should have done XYZ. Or yeah, but I wish I had done this and that. Here are some sentence frames when providing feedback that you might want to consider using, not only now, but in the future, perhaps as you're giving your patients feedback, maybe in the future when you're supervising others. Things that you want to observe, so the nonverbals. You want to notice pace, volume, tone, and body language. Again, here are some sentence stems that you can use. So in terms of the process, the group members, I want you to all be prepared to share what you observed as a group, what was helpful, what did you enjoy, what might be needed to enhance the experience, things group leaders should consider for future groups. The non-group members, or like those of you that are just watching the group, I want you to focus on what did you notice regarding the group dynamics and process. Were there any missed opportunities for further process, discussion, specific use of a group therapy skill, an opportunity to highlight the process or someone's, reaction or interaction. And for the group leaders, as you're going through this, I want you to observe yourself, the thoughts and feelings as you led the group, and the observation of group members' process and dynamics. Was there anything that surprised you during the experience? What was challenging for you? What came easy to you? Really briefly, for those of you especially that want to incorporate groups into your practice, or maybe you're still like kind of on the fence, do I want to do this in the future or not? Or maybe it is part of your job responsibilities, again, depending on the setting that you are working in. Here are some measures that you might want to consider to evaluate and to get, tangible data on how you're doing and how the group members are experiencing the group in order to provide live feedback and consider how you might improve things. So these are different instruments on screening and selection. So group therapy survey measures pro-group beliefs, the readiness questionnaire, the inventory of interpersonal problems. This is an 32-item self-report measure of interpersonal problems based on interpersonal theory. It's well established. You might want to assess the group climate. So there's a group climate questionnaire, the therapeutic factors inventory, which we went over in our first lecture, group counseling, helpful impact scale, assessment of group leadership and behavior skills. There is the California Psychotherapy Alliance scale for group, and there's also the group questionnaire. The group questionnaire, I just kind of like screenshotted some of like the items here. And again, it's available on the PDF of the slides so you can go through the questions and what it's asking for. And some outcome measures. There's the OQ45 and the inventory again of interpersonal problems, circums item response theory. I do want to spend some time on problem members or problematic behaviors that can arise in group, especially when you have um, a variety of individuals that are in your presence. So we first have the monopolist. These are individuals who chatter incessantly, anxious if others are silent, and insert themselves into all discussion. The effects on the group. They might be welcome at first. It's always really nice to have someone that's willing to talk and start the conversation, but you'll find that others will soon become frustrated and angry because they talk, 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 and don't give others an opportunity to chat. Uh, Group will eventually confront the monopolist. They tends to be an explosive rebuff. The monopolist will sulk, remain silent for 1 to 2 meetings, and may then leave the group if it is not resolved and if the group does not work through the conflict. Therapeutic considerations. Um, why do you use it? Why do you, as a group, allow and encourage one member to carry the burden of the entire meeting? So using the group process, something you might ask the entire group. Do not silence monopolists. Help them to increase self-awareness and receive feedback. Assist the group to provide helpful feedback to the group member about how they are affecting the dynamics and/or individual members. Andrew, I think it would be helpful for you to pause because I sense there are some important feelings about you and the group, and I think it would be very helpful for you to know. Speak with the monopolist and ask them to focus on the here and now. Next is a moralist. They tend to be very preachy, advice giving, pushing an agenda. The effects of the group are it shuts down interpersonal relationships. We don't feel close to those who constantly judge us or who are trying to convince us to a certain way of thinking. Some therapeutic considerations for you as therapists are ask a person about their experience. What is it like to be in the group today? What's it like to hear certain things, rather than whether a person does this or that? Next is a silent client. Less disruptive, but equally a challenging problem. Research in experiential groups found that regardless of what the members said, the more words they spoke, the greater the positive change in their picture of themselves. If after 3 months a client resists all efforts and maintains little participation, the progress tends to be poor. Prognosis, sorry, tends to be poor. Therapeutic considerations. Silence is never silent. It is still behavior that is meaning and is also a representation of how the client deals with the here and now. Again, it's a reflection of how they deal with things, and it also might be a reflection of the family dynamics that they grew up in. You want to seek to understand why the client is silent, make attempts to engage via observation. Is this a meeting where you want to be prodded? How did it feel when Alyssa put you on the spot? Did she go too far? What's the ideal question we could ask you today to help you share in the group? Next is a help rejecting complainer. Implicitly or explicitly requests help from the group and then they reject any help offered. They present large problems and take pride in that their problems appear to have no solution. They appear to be a greedy whirlpool that sucks up the group's energy. The effects on the group. The group members tend to become irritated, frustrated, and confused. Therapeutic considerations. The help rejecting complainers tend to not be aware of their lack of empathy for others. Helping them see their interpersonal impact on others may be a key step in helping them examine their pattern of relationships. Neutral or irreverent approach. Size up any expression of optimism, encouragement, or advice, and instead agree with the client's pessimism while maintaining a detached effect. Sometimes what this does is when they are expecting um, for, again, people to offer advice and suggestions, what you're doing here is that you are rolling with the resistance. And hopefully, this again brings illumination to their pattern of behaving. Lastly, kind of want to go through what happens when there's microaggressions, micro assaults, micro insults, or micro invalidations that occur in group. What do you do with the microaggression that occurred? John, a white cis male, says to Naya, a black cis female, "It's so great to see someone like you succeeding in life. You have a graduate degree. What an accomplishment." Ouch, right? Um, this may be a genuine compliment, but it does have a negative impact on the person receiving it. This is a figure of factors influencing therapists' responses to microaggressions. So there's the internal self-reflective questioning. So, am I accurately receiving this event as a microaggression? Has this evoked countertransference within me? How do I manage that countertransference? Context and identity, personal history of experiencing microaggressions in various roles, therapist intersectional identity, role as a group psychotherapist. There's a therapeutic decision making. How will my response or lack thereof affect the therapeutic alliances within the group, and what is the realistic goal of my intervention? So again, a lot of ambivalence, uncertainty, and second guessing, a lot of self-doubt. And thinking about would discussing this microaggression help the group on task or is it tangential? The therapist, it's normal to feel protective and also wondering if they will cause more harm by calling attention to it. Does it create further offense? Did everyone notice or was it just a few? There's this concept or technique of like calling out versus calling in. Calling out would be, you are so rude and disrespectful, or you really need to think before you speak. I can't believe you said that. It's this like hostile rebuff of the behavior or words. It tends to be impulsive and tends to push the person away and not engage in dialogue. A call in is a bit different. It is, in this example, I can't help but notice that as you made that comment, I cringed. I want to understand your perspective, and what sounds like a compliment is also making me cringe because of the assumptions being made about Naya. This allows a person to expand on their experience, ask questions about what made the other person cringe, and for the other group members to discuss their physiological reactions, thoughts, and feelings. This does require patience and compassion, even while holding anger, pain, and frustration. Sometimes the recognition is not immediate, and it takes some time to work through the impact of the statement that was made. So, techniques to address microaggressions. Connect it back to group techniques and group process. You want to use the here and now, confront, instruct, link, model, and provide feedback and observations. Some clinical takeaways. When psychotherapists do not respond to microaggressions, inequitable harm is done, particularly to individuals with marginalized identities. Responding therapeutically to microaggressions requires cultural humility, perspective taking, and advanced interpersonal skills. Therefore, training and practice are essential. Training on how to respond to microaggressions should occur beyond on-the-job learning to minimize potential for harm. It's really good to uh, go to take continuing ed classes in this area. And learning to be culturally responsive is optimized by multiple methods and increased engagement. Lastly, sometimes you'll be running a group alone, but sometimes you'll be running groups with other people. So co-therapy. Benefits of co-therapy. You share the burden, less chances of triangulation, better able to observe and manage dynamics. Both therapists act as a container for the room. It helps them model appropriate and healthy relationships. Some tips. You want to plan and prep who will do what ahead of time, as well as identify roles. Also be flexible if things need to change. For process groups, you want to consider each other's ideas. What questions do you want to ask? What do you anticipate? How do you want to manage situations that might potentially arise or have arisen in the past? What is your theory of what's going on? What is your understanding of the conflict of the group? Who attends the behaviors in the group? Maybe that's a co-facilitator so that the main facilitator can make sure they stay on agenda, cover the skills, continue with the psychoeducation with minimal distractions and interruptions to the group process. How will you address problematic behaviors such as the monopolizer, the silent one, the moralist? You want to tag team difficult dynamics so that one person is not left alone. It's okay to communicate with one another in front of the group members. You want to check in with each other before you move on, again, demonstrating strong collaboration and helpful interpersonal relationship skills. Ask for the other person therapist's point of view. Model respect, decision-making, teamwork, and navigating disagreements. One way to think about disagreements is this fable. It's called Two Goats and a Bridge, and we're going to watch this. There we go.
Two goats and a bridge. Here is a goat, able and strong, He can be very stubborn as he jumps along. He has a pair of curved horns, so beware, for they are as sharp as thorns. One beautiful spring day, a goat was walking along munching on weeds along the way. What a delicious taste! I can't let any of it go to waste. But then he saw that on the other side of the bridge there was even more to eat all along the ridge. In the meantime, another goat was going about, smelling the flowers. They must have just blossomed after the springtime showers. Oh, what a wonderful smell! It makes me feel so happy and well. What's that? Over there! There's even more flowers growing everywhere. I must go and see if those flowers are as beautiful to me. But when the goats reached the bridge and tried to cross, they discovered that they were both at a loss. Said the first goat, "Move aside, you hear? There's not enough room for both of us. Stand clear." Said the second goat, "Excuse me, but what you need to do is move and let me through." They argued and argued, but neither gave in. Each thought that he would eventually win. "I warn you, I will fight." "Then I will fight back with all my might." And wouldn't you know, when they began to fight, they both fell to the river below. A few days went by when the goats decided to give the bridge another try. "What? You again? When are you going to get out of the way?" "Out of the way? You're rude, I must say." And again they began to fight, each thinking that he was right. But in the end, they both fell into the river again. After a few more days had passed, the first goat arrived at the bridge. "Yes, at last, the way is clear. Oh no, I can't believe who is here." But this time, the first goat thought before he fought. "I do believe it's time to think in a new direction. Here now, I have a suggestion. I'll let you pass first and wait quietly as you do. And after you've reached the other side, then I'll cross too." "That's a wonderful idea, pure inspiration. You've found the perfect solution." And so they understood that when you argue and fight, you lose sight of what is right. So stop to listen and communicate. That way, everyone wins and feels great.
Okay, so when you're working, collaborating with others, there's always an opportunity for your heads to butt, and when conflict arises, that you two, as a group therapist, use your people skills and your relationship skills to stop, pause, and listen, and collaborate to find a solution. Communication is key, and communicate expectations, engage in dialogue, and work to compromise and resolve those conflicts. If there is tension between the co-therapists, it will show up in the room. Group members will pick up on it. Co-therapists do not need to be best friends, but need to figure out how to effectively share space in the room with each other. Thanks, and see you later this week.